Today, Nebraska's rural hospitals are struggling still with lagging reimbursement rates, higher labor costs, and aggressive practices from large insurance companies and big pharma. The financial picture for Nebraska's rural hospitals, unfortunately, has not improved in recent years, and many are still struggling to operate in the black. A recent survey of our membership showed that 54% of Nebraska's rural hospitals operated at a loss in the last quarter, and the average operating margin for the calendar year of 2024 was just 1.4%, well below a sustainable margin, and 1.4%, that's the average among all rural hospitals. These tough financial conditions have forced over 20% of our hospitals to reduce or eliminate services in the last 2 years. Critical services like labor and delivery and behavioral health. So where do we go from here? First, we need to make sure that our federal and state policymakers avoid deep cuts in programs like Medicaid. Medicaid is an essential building block for protecting rural hospitals and other critical services in Nebraska. Medicaid pays for 33% of labor and delivery costs in rural Nebraska, 43% of behavioral health care costs in rural Nebraska, and 44% of the cost of pediatric care in rural Nebraska. The bottom line is these services would not be sustainable in rural areas if Medicaid is cut at the state or federal level. Next, we have to take action to rein in the aggressive practices from large out-of-state insurance companies. Their prior authorizations and other restrictive practices delay care to patients when they need it and drive up the administrative burdens to healthcare providers. While our rural hospitals here in the state are struggling to keep their services open, we see commercial insurers report profits in the tens of billions of dollars. And finally, we must push back against Big Pharma to protect our 340B community benefits program, which sustains rural services like nursing homes, assisted living, wellness programs, and chronic disease management. While pharma is fighting across the country to halt these programs and boost their already robust bottom lines, we're going to join, with Senator Hardin's leadership, join many other states in standing up to them.